Hello and welcome back to my YouTube channel, Show Up Prepared. My name is Jean Armand. I am a nurse practitioner. I've been in the healthcare field for about 38 years, 23 of those years as a nurse practitioner. I have dual certification as a family nurse practitioner and adult geriatric acute care NP, board certified. My postgraduate degrees, I'm Emory trained. Um, my undergrad was from Seton Hall University. My master's is from Rutgers State University. I've worked in level 1 trauma, anesthesia clinic, ER for many years, ICU, CCU, telemetry, and even just family practice. So I've been around in the healthcare field. My passion and why show up prepared. I am also a owner, a franchisee for Prime IV Hydration and Wellness in Smyrna, Georgia. I've previously hosted the Health Flow podcast, and also I am the author of Show Up Prepared. It's a medical journal that I have right here. And just that's my passion. I want everyone who, whether you have an emergency, whether you're just having a surgical procedure, or you're just going to your doctor's appointment, it's important that you show up prepared. So last week I talked about why I wanted to do this, and this week I just want to start discussing the journal. Show Up Prepared, available on Amazon, and a picture of me right on the back. So, to start with, and Show Up Prepared, one of the first, um, there's so many stories why this triggered me. I remember one particular story where there was a truck driver who, driving through Atlanta from New Jersey, he had a massive stroke. We could not get into his phone immediately, and there was no way to contact any family members. Social worker really had to get involved and try to locate his family, which took weeks because all we knew was his name, and it just took a long time. And there's so many other examples that I've had. Where people just show up and they don't know their medications that they're taking. They don't know their previous surgeries. They don't know family histories. Sometimes they can't even articulate their symptoms, when it started, how long it's been going on. It's just vague. And if you show up to a medical provider with vague symptoms, it just takes a longer time. They have to throw a wider net to try to figure out exactly what's going on. So it may delay your diagnosis when you're not prepared. And so that's what I want to do, is to help, bring that gap, just bring it in so that you show up prepared. Um, I get fired up about it because I see how differently people are treated when they show up prepared versus when they don't. When you walk into a healthcare facility, doctor's appointment, and you're organized and you can clearly communicate your symptoms, your timeline, you know your family history, you know the medicines that you're taking, you know your allergies, that person is taken more seriously, because you're then engage your partner in your care instead of just someone, some things, you're just saying some things. Like, a person's going to take you seriously, more serious, if you're well informed. That's not just in healthcare, but that's in everything. So it is important that we show up prepared. um, this journal isn't just about tracking information, it's about empowerment. It's about making sure that when anything happens to you at any time, you're prepared because you just don't know what life can throw at us or at you, and we need to be ready. Your health story matters, your family health story matters, and it's time to start documenting it properly, not just for you, but for the people you love. So, um, I have a quick reference page. That's where we're going to start. And before we dive into it deeper, um, don't skip this part. Don't tell yourself you're going to come back to it because the next few pages contain the most critical health information anyone would need if something were to happen to them. Remember that truck driver I told you about? The one who spent months in a hospital because we couldn't access his basic information. These pages are what could have changed the entire situation. So here's what I want you to do, and it's step by step. Step one, fill out the pages completely. Write in a pen, be thorough. Don't do something like, if you don't know something like your blood type, make sure you make a note of it so you can inquire at your doctor. Take clear photos of each completed patient, each completed pages, and text them to your emergency contact so that they know. Tell them what it is and why you're sending it. Step three, add some information to your medical ID or your health app. This takes 5 minutes and could save your life. And step four, consider making copies to keep in your car, in your purse or your wallet. You can also give copies to close family members. I know it might feel uncomfortable to think about emergencies, but preparation isn't about being negative. It's about being powerful. It's about making sure that you show up to your health encounter, planned or unplanned, you're well represented. So grab your pen and take a deep breath and let's go. It starts with personal information. It starts with your name, your date of birth, your height, your weight, your blood type if you know it, your emergency contact and their phone number, your power of attorney and their phone number, your insurance provider and policy number. You should then list your current medications, the doses, and how often you take it. Is it one time a day or two times? Because if you're hospitalized, most of the time we want to keep you on your same medications, and that's really beneficial information to know the dosage and the frequency so there's no guesswork. You should also include in that vitamins and supplements. You should include your pharmacy name and their phone number. That's very helpful. If you have pharmacy names, sometimes we can cross-reference by calling your pharmacy to see what medications you've taken in the past, and this would help with discharge planning, that when it's time for you to go home, we have a pharmacy name and phone number that their prescriptions can easily be sent to. Next thing is now your medical history. What chronic medical conditions do you have? Are you a diabetic? Do you have high blood pressure, high cholesterol, any kidney disease, any problems with your thyroid, with your gallbladder, any gout, any chronic medical conditions should be listed there. Any major surgeries or procedures? When was your last surgery? And even preventative things, colonoscopy. When was your last colonoscopy? That's important information if you're at that age where you should be getting colonoscopy. If for females, mammograms, when was your last mammogram? Just these are important things to know. And any previous hospitalizations that should be noted, your family medical history. So that All those things are included in the quick reference page, and it's just those 2 pages that we're recommending that you take pictures of it, send it to your emergency contact or other family members, make copies, keep it in your car, or give it to close people. Chapter 1 talks about it. This is your health foundation and why it matters. So you just filled out the quick reference page. That's a huge first step. But here's the truth. Those forms are just the beginning. They give us the facts, the medical providers the facts, but they don't tell your story. They list your medications, but they don't capture how you've felt unprepared in past appointments or what fears you carry into the medical settings. This chapter is about understanding your relationship with healthcare. It's about recognizing patterns in how you show up, and most importantly, deciding how you want to show up moving forward. I've seen thousands of patients over my career. The ones who get the best care aren't necessarily the ones with the best insurance or access to top providers, doctors, nurse practitioners, etc. They're usually the ones who understand themselves, who can articulate their needs, and who came prepared. Being prepared transforms everything. It changes how you're perceived. It changes the quality of care you receive. It changes your confidence level. And most importantly, it changes your health outcomes. It is so important. You're going to be treated differently, believe me, if you are, sad to say, but if you show up prepared, yes, you'll start moving really quickly. So I have pages for you to take notes and talk about that. We're talking about your next part of this is your health story, your healthcare story. Think back to the time where you felt unprepared during a medical appointment. Maybe you couldn't remember when the symptoms even started. Maybe you forgot to mention an important detail. Maybe you left wishing you'd ask more questions. Describe that experience, and so you can learn from it. So there's a form. This page asks you to say what happened, how you felt, what information did you wish you had available, and if you could redo appointment, what would you do differently? Now, what is preparedness? What does being a prepared patient actually look like? What does that? Think about it. What does that look like for you? Is it having all your paperwork organized? Is it asking questions? Is it speaking up when something doesn't feel right? Before you can show up prepared, you need to define what that means for you specifically. How do you want to be perceived by your healthcare providers? What does a prepared patient look like to you? What stands in the way of you showing up that way? For me, if I have a medical condition that's going on, what showing up prepared looks like for me is I would, for example, go to that medical provider and say, hello, my name is Jean Armand. I am whatever my age is. I have no chronic medical conditions. I'm not allergic to any medications or nutrients that I know of. I've had, these previous surgeries. My last colonoscopy was 3 years ago. I've never been diagnosed with anything chronic medical conditions, but in the last 2 weeks, I've been experiencing headaches every day. There's nothing that really relieves the headache. It's associated with nausea, vomiting sometimes, and it happens around the same time. Nothing has really changed in my life. I don't know what's going on. So that's showing up prepared. I've taken Advil and Tylenol. I do get some relief, but it comes right back. Nothing new has happened in my life. I'm not under any new stressors. So things like that, really be intentional with describing what's going on with you. Show up prepared. So I hope you're finding this really helpful. On the next video, we'll continue to talk about the different topics, and I just want to encourage you to go ahead and get Show Up Prepared. If you have any healthcare questions, you could feel free to ask, and I will respond. Thank you once again for showing up at Show Up Prepared. Get prepared and show up for yourself each and every time.